What do I mean by anchoring, expectations, and bias? The field of behavioral economics is fascinating. When we believe beforehand that something is going to be good, guess what? It turns out to be good. And the power of our belief when we think something is going to be bad is remarkable at making something turn out to be bad. So Daniel Ariely's book, Predictably Irrational, is a great resource for those interested in this. Yesterday, Professor McEntee talked about Daniel Kahneman's book, Thinking Fast and Slow, another great resource by a Nobel laureate. So let me give you a couple of examples where our biases or our anchoring has influenced how we've treated patients in a way that maybe isn't necessarily correct. When we think of osteoporosis, here is fragile bone. The osteoporotic patient is at increased risk of fracture. We would assume that if we have compromised trabeculae, thin trabeculae, fewer trabeculae, that the bone, therefore, is more fragile, and that this would transcend the skeletal aspects at the hip, the vertebrae, and the wrist, and also affect the jaws. We might even suspect that the maxilla would be more affected than the mandible, based upon what we know about the basic architecture of the two jaws. We also know that smoking fundamentally affects wound healing and the inflammatory process. So we would also think that smoking could significantly compromise our patient care. Two logical anchors that influence our expectations, but unfortunately can bias us to treat our patients incorrectly.